lucky to have an up-and-coming company that's doing some exciting work in social determinants. So I am very pleased to welcome Ruben Amarasingham. He is the founder and CEO at Pieces Technology. He's going to come up here, we're going to kick it off with a little video, and then he's going to take it away. So please join me in welcoming Dr. Ruben.
Children and the families that we serve live and work and play in our community. And until we found Pieces Technologies, we had no way of connecting their activities where they live, work, and play to their health. And Pieces has allowed us to make those connections and to create decision support solutions that will allow us to keep the kids we serve healthier and, in fact, their families healthier.
We had several issues that we were facing. The main issue was being able to connect all of the data that we collect in aggregate from the clients from the time of intake on forward. The second issue was really connecting to all of our partners and providers in the community.
Pieces Technologies helped us solve some very important problems that we had in terms of maintaining different databases.
We had significant amounts of patient data. We had a lot of clinical data. We had a lot of long-term, longitudinal data about our patients. We didn't have a way to turn that data into action.
The needs of every hospital are different because the population that go to those hospitals are also different.
Pieces Technologies allowed us the opportunity to connect to the partners and providers that we already were associated with.
Pieces is in our electronic health record. So it's really available at every interaction with every clinical team member and even with a patient. So it's making it a great discussion during huddles to look at, who are our patients who are at high risk, what interventions do we really need to apply to this population.
For us and for our staff, it was just easy to be able to use Iris because there was a one-stop solution for keeping track of all our data needs.
What Pieces Technologies has allowed us to do is to really identify the right population and also identify the right intervention to show that it works in reducing readmissions.
At this point, Unlocking Doors has over 4,000 clients. It's invaluable to our clients and to getting them served.
EMRs do a good job of accumulating information, but not a very good job of helping you decide what to do next. Pieces Solutions complement the electronic health record by doing the things that an electronic health record was never designed to do.
Hey, thanks so much. My name is Ruben Amarasingham. I'm the founder and CEO of Pieces Technologies. It's a real honor, and I want to thank the conference organizers for letting me say a few words. So we're a mission-oriented company based out of Dallas, Texas, that actually spun out of a safety net hospital, Parkland Hospital, where a lot of the factors of social determinants was something that was impacting the patients. So housing, homelessness, food insecurity, domestic violence, all of those issues extremely challenging, and it's becoming recognized as a bigger and bigger problem. It's for those that are working on it, health systems that are working on it, we know how intractable an issue it is, and so we came up with a specific way that involves the community and uses things like artificial intelligence to try to tackle this problem, and it required a sort of very mission-oriented approach. But the first is that there, across the United States, in thousands of communities, there's these amazing nonprofit organizations that are working on these very challenging issues, and you saw two of them there. One was Unlocking Doors, which helps bring incarcerated individuals or people that have been in prison and bring them back into society. The other was LIFT, which was a literacy program for kids. There's school systems, housing organizations, homeless shelters. They're all working on factors that actually end up impacting hospital readmissions, length of stay, and other elements like that. So the first thing we decided to do was to try to build a 2019 type of platform, a cloud-based platform that any organization could basically use to manage their clients. That's a nonprofit community organization, but build a healthcare data model in the background that could then connect to any EMR. And we're now launched and we're operating in 9 states. And the second part to that, we think, is that if you're in the health system, it's more than just being able to connect to these organizations and bringing you through. But by using modern AI approaches and machine learning, we can read everything in the electronic record. It's getting easier and easier to do this. More and more companies are capable of doing it through cloud-based and other technologies. But reading the doctor's notes, case manager's notes, and other providers' notes in real time, there's a ton of social determinant information in there already that's not used. I think a big theme of this conference is what is the sort of wasted data and information that's written once and never reviewed again. So we should have technologies that do the heavy lifting so that the providers, the nurses, doctors, and case managers can go about their work. So by using natural language processing, machine learning, it's possible to get a lot of these social determinants out and then be able to connect the loop with organizations in the community that are doing great work. I think we're on an era of being able to really build true integrated cross-sector networks that can build observational data that helps us connect what's the linkage between diabetes and housing in very profound ways, all the way down to more specific elements like limb salvage and food insecurity. So I think it's an amazing time to be doing this work. I know a lot of the folks in this room are working on this. There's many companies working on this, and it's a real honor to be able to address you. Thanks so much for giving us the opportunity.